Khi nói đến sắc đẹp là nói đến sự hãnh diện và tự tin. Loan Châu xin hân hạnh giới thiệu đến quý vị Coast Surgery Center, một trung tâm giải phẫu thẩm mỹ với đội ngũ chuyên viên được huấn luyện kỳ cựu trên 25 năm kinh nghiệm, sẽ giúp quý vị có được một thân hình tuyệt hảo và trở nên tự tin hơn, sức khỏe, sự an toàn, thân hình của quý vị và nhất là sự tự tin về sắc đẹp của chính mình. Với những thiết bị hiện đại và tối tân, chúng tôi có đủ điều kiện và đạt tiêu chuẩn hàng đầu nhằm đảm bảo sự an toàn tuyệt đối cho quý vị. Giám đốc y khoa là bác sĩ phẫu thuật được huấn luyện đầy đủ và dày dặn kinh nghiệm. Cùng với đội ngũ bác sĩ Mỹ và Việt có board certified, quý vị sẽ hãnh diện hơn với thân hình của mình khi đến với Coast Surgery Center. Hãy gọi cho chúng tôi ngay hôm nay tại 1855 A New You để được tham khảo miễn phí. 1855 263 9968. Coast Surgery Center sẽ giúp quý vị lấy lại niềm hãnh diện và tự tin.
Chương trình này được bảo trợ bởi Coast Surgery Center.
Thưa quý vị, và xin quý vị chào đón trở lại với bác sĩ Mukadam. Hi doctor, thank you so much. I think we have a lot more to talk about regarding breast augmentation. So to repeat about what we said earlier, that the breast implant, there are two types, saline and silicone.
Yes.
And of course, silicone right now is much better than before.
Yes.
And silicone, they call it memory gel.
Yes.
And the texture just like gummy bear. And it's really safe.
Yes.
It won't have any problem like lickings or anything like
So
that.
far, I've never not seen even one problem.
Not even one problem.
Yes.
What is the recovery time for that?
Like any surgery, 1 week is a minimum, 2 weeks is best. With breast implant surgery, after breast implants, because they go under the muscle, it's a good idea not to go to the gym for a while, like a month, and lift weights or do anything strenuous for about a month. But in 2 weeks, if everything goes well, you can start working out little by little, slowly, and get into it, and take another week or two to be fully possible to do all the exercises and workout that you are used to doing.
How long is the procedure?
Procedure takes anywhere between 1 and 2 hours.
I see.
If you're feeling saline, then you fill up little by little, so it takes a little bit longer. When you put silicone, you don't have to fill it, it comes pre-filled, so it's much faster. But any breast surgery can be minimum 1 hour, maximum 2 hours.
Is it under local anesthesia?
No,
or
it has to be under general anesthesia. Some people do under local anesthesia. I don't recommend it. You need to put the implant under the muscle. So you actually have to create a pocket, go under the muscle on the chest wall. So that takes a little bit of work.
A lot of work.
Yeah. I think general anesthesia is definitely what I've never done under local anesthesia, and I would never do it.
Right.
It's general anesthesia, about 1 to 2 hours of operating time, and then the recovery in the surgery center for another hour or two. So in 4 hours, you're done, you're back home.
So total time will be 4 hours.
4 to 6 hours.
Get in and out is about 4 to 5
yes,
hours.
Yes.
Yeah.
And recovery, first 4 days, I recommend do not go out, stay home. Don't lift anything heavy, don't raise your arms. You have bandages that you leave alone. You don't need to remove. So you can't wash the chest. You can wash lower body, you can wash your hair, but not your chest. After 4 days, everything comes off and you can take a shower. I recommend taking shower, not a bath. You can't go underwater. And wear sports bra for day and night for 2 weeks. And then there are certain things that need to be done to move the implants. That starts after the second week and goes on to 3 months.
I see.
And we call that massage. Basically what it does is helps create a pocket that doesn't become tight and close. So it keeps it open.
So you have to exercise,
Right.
make it exercise.
Massages.
Massage
we call
it,
it.
yeah.
Every day about 20 minutes a day for at least 3 months if possible, even up to a year. Yeah. Sometimes, depending on the size, you need more massage or less massage.
I see.
So if you go a big size, the weight of the implant itself will
Heavy.
stretch the pocket.
Right.
So you don't need as many massages.
I see.
But if you're smaller size, then you need a little more
Massage.
than necessary. The companies who make implants, they give you lifetime warranty.
I see.
So they say if everything is good, you don't need to remove and
I
replace
see.
it.
Yeah.
But what has happened is, like everything else, things get old. So our body changes. So in 5 to 10 years, you and I will look different. So best is to reevaluate in 5 years. If it's still good,
Then
don't
leave
worry
it
about
alone.
it.
Yeah.
But 10 years, everybody changes a little. So if you want to change, take it out and put new ones. But it's not going to disintegrate or cause any problem or deflate or things like that. The older silicone, yes, that happened a lot.
If leaking,
Yeah, it leaked and it
Rupture.
disintegrated and ruptured. But these newer implants don't do that. So far, I haven't seen it, and I go by companies giving you lifetime warranty, so it must be good for
the
lifetime.
lifetime. So it means that whatever I heard it's just a rumor.
Right.
It's just a rumor.
In saline implants, it's a little different because
Right.
you put
Water in.
salt water
Right.
inside, and the water is handled. Sometimes people use a closed system from bag to tube to implant.
Right.
Then the water doesn't come in contact with the air. But if you empty it in a bowl and fill it up, then the water is handled and it comes in contact with the atmosphere. So there is a chance that in 5 to 10 years something may grow in it,
Yeah.
and the water may not be as clean as it was at the
So,
time.
I see.
So some people say, anyway, 5 to 10 years, you just see how you feel and how you look, and if you want, best thing is to take it out and put new implants.
Right. So can you talk to the audience as well as me
Sure.
about that kind of procedure, the eye and the nose that you do? I know that you do quite a lot of that every day.
Yes. Eyes and nose. They say eyes are the windows of your soul. So when you look at people, first things you see is people's eyes. So it's very important to make the eyes look better. And it's a very easy surgery. It's much easier than breast surgery. It can be done under local anesthesia.
But people are still awake and know what you're
Yes.
doing. Is that very scary to
Not
know?
scary. I mean, there's some people don't like it and say, no, I don't want to be awake and go to sleep. But some people don't like to go to sleep. So it's easy. You just inject local anesthetic and it's numb.
It's scary. So should you have any kind of medication that calm them down?
Yeah, that's possible. We give Versed or Demerol. And there are many sedative
So they can a little
medicine.
buzzy, a little bit,
Right,
right?
so
Yeah.
a little sleepy.
Sleepy.
Yeah, and not be anxious and worried about.
Right.
But very important is when you do under local that you cannot move. So when I'm doing surgery, I tell them you cannot move your head. If you feel like moving, you let me know first. I have knife in my hand. So yes, under local, but it can be done. So some people who have phobia about anesthesia has gotten a very bad name in the past. So they can very well do under local. And it involves only removal of skin, muscle and fat from the eyelid. We don't do anything to the eye itself. So your vision is not affected.
Not affected. Yeah.
It's only outside the eye, the skin that covers the eye is trimmed, the fat underneath is removed, and the muscle is rearranged and taken out. So it gives you a nice crisp fold, and all that loose and redundant skin is gone. So the eyes look
better, brighter.
much brighter, more open. But technically, it's the same eyes. Your eyes don't
Right.
change. But because the surrounding change, they look better. And they make you look
Young.
at least 10 years younger.
So how many type of, because I heard that there's a eyelid
Yes.
and brow lift. So is that considered as
brow
eye
lift
surgery as well?
Brow lift is very different. I was talking about just eyelid surgery, which is called blepharoplasty. So it's upper eyelid and lower eyelid.
I see.
Both are similar procedures. You remove skin, muscle, and
Fat.
fat. And some people have a lot of eye bags, and that's because of the fat.
I
So
see.
you have to remove fat.
And here the upper eyelid as well.
Yes.
So when we do the upper eyelid, it will have the eye even deeper, or
Yeah,
go back to the original eyes.
Yeah, it's just that extra skin is gone, so it looks more crisp. The fold looks very nice. And there's a scar that's visible when you close your eyes. You can see the scar.
I see.
But on the face, in general, the scars are so much better and they heal so well. After 6 months to a year, you can hardly even see it. I myself have difficulty finding the scar sometimes.
Talking to you, I have to go home and look at myself in the mirror, and I know that a lot of things we have to fix.
Well, eyelids is number one, I think is very important. And it's easy surgery. It's not, the chances of complications in breast are much more than the eyes. In the eyes, if you do it right, it looks beautiful and comes out nice and it's easy. But yes, if you don't do it right, if you remove too much skin, if you get infection or didn't do it right, then you can have trouble, and that problem you'll see forever when you look in the mirror.
Right.
Yeah. But fortunately, I've been very lucky. My patients are all very happy. I don't have even one patient that complains of eyelid problem.
Right.
And I always recommend, when I'm talking to patients, first thing I see is the eyes. So
Yeah.
I can tell that I can make your eyes better. So it's a nicer surgery, easier surgery.
I saw one of the case that you done already, and it looks very natural. Right after, I think within a week that they got done.
Yeah.
It's just very amazed to see that. But how long is the procedure?
Each eyelid takes about half hour.
Only
So,
half an hour, 30 minutes.
Half hour here, half hour
So
here.
1 hour.
So upper lids, if I do 1 hour. In the lower lid, I take 45 minutes because it's very close to the eyelashes, the cut, and I put some stitches, 2 layers, so it takes a little bit longer because lower eyelid is very important, and if you get something like that, it's a
yeah.
very bad complication. So you have
Right.
to put
Very
it back
careful.
together nicely, and I take a little extra time for that.
But if for the upper eyelid, if you don't do it well, it might be have one small and one bigger eye. So you have to
Definitely.
calculate it.
Not
very
only
careful.
that, sometimes if you remove too much skin, then the person cannot close the eyes.
Oh, that's the case?
Yes, that can happen.
If you remove too much
Right.
of the skin,
Yes.
a lot of people, I can see that. That's why I'm concerned for people outside as
Sure.
well. A lot of people that when they close, I can see
Cannot
that it's
close
not really
completely.
Yeah,
Yeah.
don't close probably.
Yeah,
So,
that can happen. So
yeah.
you have to be very
Can we
careful.
fix that kind of problem?
Well, yes, in some people you can fix it, and you have to do, even people who have ptosis, the eyelids are not opening completely and droopy eyelids. So those are different
It's
surgeries.
fixable.
Fixable, but they are different surgeries.
I see.
This blepharoplasty is not just for that. It's a cosmetic blepharoplasty.
At least let people know that it's fixable, because a lot of
Yes.
people, they have the kind of problem. They think, they have to live with that forever.
No, it is definitely fixable.
That's great. And the fixing, how long will it take? Is the same procedure?
Yeah, it takes a little bit longer, and it may even require skin graft or
Skin graft.
mucosal.
Give them more skin.
Yeah, or sometimes they take mucosa from the mouth and put there, depending on how much reconstruction
They have
is
to come in
needed.
and consult.
Yeah, right.
And you can see with their face.
Yeah, I don't do that kind of surgery. That's a reconstructive eye surgery, and I prefer to send them to eye doctor.
Right.
Yeah, it's a little more demanding. But I have never had any patient requiring that surgery, so
It's very
I've been
interesting.
lucky.
How about nose?
Nose is also very important surgery, and nose surgery are two kinds: augmentation or reduction. In people with flat dorsum, with the bridge of the nose is flat.
Some of bridge flat. Yeah.
Flat.
Yeah. So they have.
They need to put a implant or cartilage or something inside to raise it up. So it's called augmentation rhinoplasty. And some people have a big nose, so you have to remove some to reduce the size of the nose. And it's a very, very gratifying surgery. All my patients are very happy. I like to make things natural and normal looking.
Right.
I don't like to exaggerate, do too much or too little. That is what plastic surgery is about. When you do surgery that you cannot tell that you had surgery, but better than somebody say, "Oh, you had surgery." So I think in nose that is very important, that how much to remove if you are doing to reduce, or how much to augment if you're increasing. But yeah, I always do surgery from inside the nose, but there are two ways to do: inside only, or some people will cut here and flip the nose open.
I think I have to invite you back for another show then, because we don't have enough time. The machine come up, we only have 1 minute left, and we have a lot of things to talk about, Dr. Mukadam.
Well, surgery is like that. There's so much I can talk about, and we didn't even talk about sizes of implants.
Yes.
That was a very important topic I wanted to say.
Would you like to come back to us?
Yeah, absolutely.
Yes.
Anytime.
But thank you for
giving.
Thank you for a lot of information. I learned so much about everything that you covered today.
I'm happy that you were able to get some more.
I have a free consultation today. It's great. But thank you, Dr. Mukadam. I hope to see you next time. Cảm ơn quý vị đã theo dõi chương trình Sức khỏe và sắc đẹp của chúng tôi của Coast Center. Xin quý vị hãy đến với Coast Center và hãy gọi vào 1855 ENEW hay 1855 263 9968 để được tham khảo miễn phí với Dr. Mukadam. Xin lỗi quý vị cho không có giờ để mà dịch lại cho quý vị hoặc là nói cho quý vị những cái gì mà chúng tôi vừa nói qua về breast implant, về sửa mắt và sửa mũi. Sửa mũi thì không có giờ rồi thưa quý vị, thì hy vọng quý vị sẽ tiếp tục theo dõi chương trình chúng tôi vào chương trình lần tới. Một lần nữa, chúng tôi cảm ơn quý vị thật nhiều. Thank you, Dr. Mukadam, so much, and I hope to see you soon.
Okay.
Hope you have a wonderful New Year.
Thank you very much. I appreciate, and I'll be willing to come anytime you want.
Thank you so much. Khi nói đến sắc đẹp là nói đến sự hãnh diện và tự tin. Loan Chau xin hân hạnh giới thiệu đến quý vị Coast Surgery Center, một trung tâm giải phẫu thẩm mỹ với đội ngũ chuyên viên được huấn luyện kỳ cựu trên 25 năm kinh nghiệm, sẽ giúp quý vị có được một thân hình tuyệt hảo và trở nên tự tin hơn. Sức khỏe, sự an toàn, thân hình của quý vị và nhất là sự tự tin về sắc đẹp của chính mình. Với những thiết bị hiện đại và tối tân, chúng tôi có đủ điều kiện và đạt tiêu chuẩn hàng đầu nhằm đảm bảo sự an toàn tuyệt đối cho quý vị. Giám đốc y khoa là bác sĩ phẫu thuật được huấn luyện đầy đủ và dày dặn kinh nghiệm, cùng với đội ngũ bác sĩ Mỹ và Việt có board certified. Quý vị sẽ hãnh diện hơn với thân hình của mình khi đến với Coast Surgery Center. Hãy gọi cho chúng tôi ngay hôm nay tại 1855 ENEW để được tham khảo miễn phí. 1855 263 9968. Coast Surgery Center sẽ giúp quý vị lấy lại niềm hãnh diện và tự tin.
Chương trình này được bảo trợ bởi Coast Surgery Center.